Hey guys, G-John here. Now let's get up from the lower extremity in the waist and move into the upper extremity because a lot of swimmers have flaws in their shoulders and their head, all this stuff. So, let's talk about the swimmer that's crossing over, swimming like this the whole time, giving themselves impingement over and over and over. As a doctor of physical therapy, this is something that blows my mind. I don't know how swimmers can get away with this without having even more shoulder injuries. I mean, 81% of swimmers report shoulder injury at one point throughout their career. Probably not 100% when you see all these people with all this crossover swimming. This is pretty much impingement over and over. The rotator cuff muscles just banging right there on their acromion over and over. Okay? So some ways to improve this are improving the muscle length, strength, and timing around that muscle. I really stress this issue because you know what? It works. Plain and simple. Okay? So our society, promotes us to be down here playing World of Warcraft all day, hanging out, eating potato chips. But we got to start getting out of that position and getting into a little more optimal position. So when you're in the pool and you're swimming, you can improve. A lot of coaches say, bend that elbow, don't cross over. Here's your center line, don't get over on that across the line. But some people just don't get it. And it's not their fault. They're trying their ass off. They just don't know how to activate this muscle because maybe their muscles are shortened around there, their muscles are weak, or they just, they got the strength, they got the length, but they don't know how to use it. They don't have the right timing of these muscles. Okay, so the ones that are often tight, preventing this motion, are the levator scapulae, the pecs here, and also the lats. Okay, and these muscles are overworked in swimmers, and all of them called internal rotation and sort of this adduction or bringing your arm in across your body. So if this muscle's tight here and you're coming down your pull, it's going to pull you across even more when you activate it, okay? Especially if you have weakness in some of these other muscles around there. The upward rotators, the ones that keep your shoulders back, the scapular stabilizers. So muscles like the middle and lower trapezius, as well as the serratus anterior, okay? Those finger muscles that you see in boxers, things like that. So some ways to check to see if this is the common flaw is to check muscle length of these muscles. You can do different testing here, seeing which ones are long. You can also do strength testing of these periscapular muscles in their stomach. I'll be posting videos of all this stuff. And then maybe they don't have proper timing. Maybe their shoulder doesn't know how to position in space, or they have the strength down here, but as their arm gets up here, as it's moving, it can't fire properly. So doing stuff with maybe perturbations or different activities where you're on an unstable surface going through a different range is very important. I've seen Dave Saylor, the coach at USC, utilize this strategy. Actually, in the pool, he uses wiffle balls. You're pulling through. The wiffle ball has all those holes in it, and as you pull that ball, it's going to move side to side. You have to really work to stabilize. So I would use this tool not with someone who's actually crossing over, but someone who's gotten better at it and is not crossing over. Because unless you're a good swimmer that actually knows where your arm is spaced, that wiffle ball could cause some more stroke deviations. So that is a tool later down the line that you could utilize. Okay? So those are some areas that you can improve if you have that crossover swimmer, the super impingement, boom, 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 boom. Remember, swimmers take more strokes than a pitcher throws in a game, okay? A lot more overhead stuff in swimming than any other sport, okay? Just think about it. A pitcher, a little league pitcher has a pitch count of 60 or 70 per game. I don't know what the exact number is right now. Swimmers, you think your swimmers take more than 60 or 70 strokes of practice? I guarantee it. Imagine if they're going like this every time. You're asking for shoulder injury. You know what the worst thing for swimming is? Being out of the sport, being injured, because then no one's getting better and no one's happy. All right, take care. G-John.